The importance of the patient-physician relationship, in my opinion, is basically one of establishing trust between a patient who has a need for professional care and hopefully having a physician that is not only qualified but is compassionate in their care. That will lead most likely to the best outcomes in that relationship.
I think my favorite thing about my specialty is just getting to know the patients and really connecting with them and just being able to see through them things that I have done to help their lives be better.
I enjoy my job. I enjoy being a part of helping people overcome problems, both physical and sometimes psychological. That's something that we all go through in life, and that's what kind of guides me every day and encourages me, motivates me to come to work. And this is such a great community to live in and be a part of.
My family-centered approach is that I believe in partnering with the patient and their family to really decide what the best treatment option is for them. And when you build that trust and they trust you, patients tend to have better long-term outcomes.
Providing treatments to the residents of Big Spring is not only a learning process, but also an enjoyable experience. It also entails hard work and dedication.
Medicine has come such a long way. There's so many things that we can prevent now, and in preventative medicine, we're in control of the disease. As opposed to reactive medicine, the disease takes over and we're just treating the symptoms of the disease. In prevention, we can control the disease, saves money, saves time, can save your life too.
I was privileged to have some mentors early in my education process in junior high and high school who steered me in towards medicine, and I realized that was kind of where my passion was. As a family physician, I'm able to help many people of many ages, and it's just something that I enjoy doing, and fortunately Big Spring has provided a great place for me to do that.
Well checks are important for adults, so we can do preventative measures and preventative testing so we can catch diseases early and then help with reduce the risk of the disease. It is very important to me to spend a lot of time with my patients, allow them time to express all their concerns. When you're in family practice, you don't just treat one problem, you treat the whole patient.
Nurse practitioners in general are educators, first and foremost. I mean, like I said, good patient care revolves around patient education, so it's really important that we do educate our patients in whatever we do. So evidence-based practice is an integral part in patient care because I want to treat my patients with what's been tried and true. Evidence-based practice, it's been around. Usually it takes about 10 years for something to become evidence-based with the research. So by the time it gets to me, I know that what I'm treating my patient with, medication or intervention, it's going to be safe for them.
I really like to work with geriatrics because I know I can help them with regards to making their life more comfortable, especially at the end of life. And I feel that I have the knowledge and this opportunity to help them with that.
In internal medicine, the most important is to spend time with the patient because they usually have a range of issues and problems that are extensive, from arthritis, diabetes, heart disease, asthma, you name it. So they require a lot of time compared to other subspecialists in which they just have one problem and then one is solved, it's gone. In internal medicine, they're usually elderly people that require more time than other issues.
Understanding our patients in our office is really, really important. Helping them to know their wishes, and help incorporate that into what we're doing in preventing and treating is most important.
In a small town, you're not just gonna be the general pediatrician or the town doctor. You're everything.
Well checks are very important in the pediatric population, as it can help me guide my practice to determine any type of developmental delays or abnormalities present. With this, I'm also able to properly educate parents and hopefully provide the proper resources that they need to help their child.
You not only get to know the child, you get to know the parent and what they're like. You know, you watch them, you know, over time, and you have to build that trust. You know, trust is built. You know, it's earned.
As a patient myself, and having my daughter come to this practice to see Dr. Chavez, I know the importance of having the time spent with the practitioner or the doctor to talk with them, form a bond. And so I want that for my patients. I want my patients to be able to feel like they can call me anytime they need, that I can hopefully answer their questions, and if I can't, I can find someone that can. And just, again, being a mom, a parent that doesn't know everything because I don't know everything, I like to just have that trust and relationship with them.
So I think it's really important to make sure that younger patients feel comfortable coming to see the gynecologist so that in the future they're empowered to take care of their health. And the way that I do that is by trying to make their first gynecology appointment not scary.
So when I do see my younger patients, the first thing I do is I bring them in the office by themselves. I make the mom stay outside just for a few minutes, and that just gives us time to talk. It gives them time to settle down because they are nervous about coming to see me. And it just gives us time to develop a little bit of a relationship before I bring their mom in. I love that opportunity to be able to tell them, you know, explain to them what's going on in their body so they can understand a little better. I love that I'm their safe place to be able to come.
We pretty much, being in a smaller town, we take care of just about everything. Very important to get the prenatal care, so that way we have a better idea of what's going on throughout the pregnancy. Better to get it earlier than later because we get more information. Now, the earlier we get, say, an ultrasound, we've got better dating criteria, so we know exactly what's going on. If you aren't getting care, we might not know if you're diabetic. We might not know if there's some other issues going on. You might not have gotten an ultrasound to see if there was an anomaly with kiddo. When you walk in without prenatal care, there can be a lot of surprises. You know, to have good communication with them, it's kind of the same thing with anything in life. Marriage, whatever, you gotta have good communication to have everything work right.
As an OBGYN, we develop a relationship with patients from the time we deliver their babies up until they're older and they need care then. So it's a really lifelong, rewarding relationship that we can develop with patients. Here in Big Spring, I've been able to develop a relationship with some of my patients' entire families. I take care of moms, grandmas, daughters, aunts, cousins, so that's a wonderful thing about a small community.
Minimally invasive surgery is at the forefront of medicine today. Surgical intervention involves using smaller incisions to gain access to different parts of the body. The advantage of this approach is basically smaller incisions, which accompanies less pain and a quicker recovery. Wound healing still takes the same amount of time, no matter how small the incision, but patients experience less pain and recover quicker.
Determining the best course of action, I always make sure that I continue to stay up to date on any current medical conditions or diagnostics, as well as making sure that I am on the same page with the patient so that our goals are aligned. I enjoy working with athletes just because they tend to be a lot more grateful as far as wanting to get back into their sport. They're really eager to rehab and do the work and put in the work that's needed to get them back out there.
In my opinion, the most important part of having local community hospital care is that you're close to your own environment, and most importantly, your family is available to provide additional help that you may need in the recovery process. Wound healing and nutrition, being home in your own environment are critical to a successful outcome from surgery of any kind.
I believe in the toe and flow approach, which it means that most of these ulcers, if there's no adequate blood flow to the foot and leg, it doesn't matter what I do, these things won't heal. So we work in concert with radiologists to do arterial studies, venous studies, and then we work in concert with the vascular surgeons to make sure that these people have adequate flow. But all that plays in concert. We need vascular, we need infectious disease, we need the hospital group to help manage these patients properly. It's not just one person, it just doesn't work that way.
You know, it is important for the patients to be able to stay in their community and feel like they have somewhere to go and somewhere they trust, and so they don't feel like they have to go out of town, and it can cause undue stress for the patient.
So I think it's really important that women are able to get the care that they need here in their own community. They shouldn't have to drive an hour to deliver their baby. They should be close to their family. If they need a surgery, they should be able to do that here in our community. We should be able to diagnose cancer and take care of issues that women need here in our own community. We shouldn't have to travel for these basic healthcare needs.
It is really such an honor for me to be able to walk with my families and watch as their families grow. You know, it's fun to have been able to treat a young woman just starting her family when I first started working here 15 years ago, and now I'm getting to watch as her children are now growing and I'm getting to treat her children.
I really love it when I get a patient in my office that I've known since I was a kid or since I was a teenager, and they see me and they're actually willing to trust me with their care. So it's very fulfilling, very rewarding that I have the potential to impact their life and their health. So.
Yes, it is very rewarding to be back in this community and serving the community who raised me. And you know, I have patients that come in that I've known them since high school. I went to high school with them. Now I'm seeing their kids, and it's just funny how it works out, but I absolutely love it.
It really is neat to come back here and to take care of people because we know them on a personal level. Some of these people I've known my whole life, and so it really is an honor to be able to take care of them or to take care of my friends' grandparents or part of their family that you've just known forever.